Hi, good morning. My name is Lennon Ryan Abunas, and this is my video for my physical assessment. Um, yeah, assessment. So, before we start, I'm gonna go ahead and let you know what supplies I'll be using for today's assessment. First, the most important is my stethoscope and my reflex hammer, tongue depressor, cotton buds, Snellen chart for cranial nerve number 2, my pen light, and perfume for olfactory cranial nerve number 1. So I want you to introduce to my boyfriend. His name is Eli. He will be helping me today for my physical assessment video. And so before we start the assessment, first of all, we need to wash our hand for infection control, and then we're supposed to put the curtain so for privacy. And then I'm gonna go ahead and start my assessment, my scenario. For example, we're in a hospital and he will be my patient for the assessment. Okay. I'm gonna greet my patient. Hi, Mr. Eli. My name is Ryan, and I'll be your nurse for today. I will be doing a physical assessment to you today. How are you today?
I'm good, thank you.
Good. I'm gonna go ahead and check for the armband just to make sure he is the patient that I want to see, that I'll be attending to. Um, Good. So can you tell me your name?
Eliza Covarrubias.
Good. And do you know what today's date?
Yeah, today's August 1st, 2020.
Good. Do you know what time is it? Do you know where you are right now?
Oh, yeah, the hospital.
Good. So patient is alert times 3 from person, time, and place. And can you also tell me your date of birth?
1/15/1980.
Good. That's confirming it. Do you have any allergies?
No.
No allergies. Do you have any pain at the moment? Pain, denies of any pain. And also, vital sign was taken prior to the assessment, and the vital sign are stable. So I'm gonna go ahead and start with my assessment. First, I'm gonna go ahead and check for the hair. We're gonna start with the hair. Hair is, oh sorry, I just want to make sure I'm not blocking. Hair is intact, no patches, no open sore or open wounds. Good. So I'm gonna check the ear. This side of the ear, it has no blockage, no open sore, no drainage noted. I'm gonna go to the next ear. No noted blockage, drainage, and open sore. I'm gonna go ahead and, excuse me, check the eyes. Can you open the eyes? No drainage, no discoloration, no open sore. So then I'm gonna go ahead and check for the nose. Both nostrils are no blockage, no open sore, no drainage. Can you go ahead and open your mouth? Can you stick your tongue out? The mouth has no discoloration, it's reddish, and it's normal, and no patches. Good. My next one will be palpating the neck. So the neck is symmetrical, no palpable masses or anything. Then I'm gonna go ahead and check the lymph nodes. I'm gonna check for posterior auricular, occipital, preauricular, submandibular, submental, and subclavian. No noted lymph nodes are palpable. and it's normal. Nothing, no mass or anything. And then I'm gonna go ahead and check for the carotid pulse of the patient. Carotid pulse is intact. It's regular and no bruit. And then I'm gonna go ahead and check for. I'm gonna go ahead and compare the apical pulse to the carotid. Okay. Carotid pulse and apical pulse is symmetrical and no noted bruit and the pulse is regular. So I'm gonna go ahead and start with my cranial nerves. Oh, first of all, before I start with the cranial nerve number 1, I'm gonna go ahead and do my check the JVD of the neck. If you can move a little bit more closer here. Yes. So if you can turn from side to side for me. Good. So no JVD noted on the neck. So then I'm going to start with my cranial nerve number 1, which is olfactory.
Yeah.
Okay, olfactory, cranial nerve number 1 is intact. Snellen, and then for cranial nerve number 2, we usually use the Snellen chart, but prior to the assessment, we took the Snellen test, and the patient is cranial nerve number 2 is intact. Patient's vision is 20/20 and normal. Then I'm gonna go ahead and check for patient's pupil for cranial nerve number 3. Can you again look at me? Good. Pupils equally reacted to light. And I'm gonna go ahead and check the accommodation. Can you look at me? I look at the pen, sorry. And then without moving your head, just look at this with your eye, okay?
Okay.
Good. And then I'm gonna look at this pen again. Good. So patient's cranial nerve 3, 4, and 6 is intact. Eye accommodation is good and normal. And then I'm gonna go ahead and check for cranial nerve number 5. If you can close your eyes and tell me if you feel this.
Yes. Yes.
Okay, cranial nerve number 5 is intact. I'm gonna go ahead and check for the next is cranial nerve number 8, which is vestibular cochlear. I'm gonna go ahead and whisper something to the patient. If you can close your eyes.
Yes.
Can you tell me what I whisper?
1, 2, 3.
Good.
1, 2, 3.
Good. I'm gonna go ahead I'm gonna check for Romberg's test too. So if you can go ahead and stand up, sir. And then go ahead and close your eyes. Good. Patient. And then can you, since you're already standing up, do you mind walking for me? Good. You can go ahead and sit down. Patient's cranial nerve number 8 is intact. Romberg's test is negative. Patient has good gait. So patient's cranial nerve number 8 is normal. Then I'm gonna go ahead and check for. Can you go ahead and stick your tongue out? Can you move it from side to side? Good. I'm gonna go ahead and use this to check for gag reflex. Can you open your mouth, stick your tongue out? Good. Okay, good. Gag reflex is intact. Can you go ahead and tell thing? Can you stick your tongue out and say Good. Cranial nerve number 8, 9. Sorry, cranial nerve 9, 10, and 12 is intact. And then I'm gonna go ahead and ask him. Can you shrug your shoulder? Good. Cranial nerve number 11 is intact as well. I'm gonna go ahead and check for the upper cerebellar. Can you go ahead and do this, sir? Like each finger, not like touching it. Upper cerebellar is intact. Can you go ahead and do shin, heel to shin, like this? Good. So the lower cerebellar is also intact. And then I'm gonna go ahead and check for the chest. The chest is symmetrical. The lung expansion when the patient breathes is symmetrical as well. Everything is normal. Patient has no noted scar, no past surgery, no open wound in the chest, no noted. Everything is normal. I'm gonna go ahead and assess for the brachial pulse. Check the radial pulse. Brachial and radial pulse is intact and palpable, and it's regular. I'm gonna go ahead and ask the patient for his strength. So can you go ahead and put a hand grip on me? Good. Hand grip for both hands are equally in strength. And then I'm gonna go ahead and ask you to go ahead and flex and move your arm from side to side. Good. And then I'm gonna go ahead and check for capillary refill. Capillary refill is normal and there's no delay. Good. How are you feeling, sir, so far? Good.
Thank you.
I'm gonna go ahead now, start checking for the heart. First, I'm gonna start checking the heart from the aortic. Aortic valve is palpable, there's no bruit, and it's regular. I'll go to pulmonic valve, pulmonic valve is palpable. And I'm going to go to the Irv's point. Irv's point is palpable and regular. And then I'm going to go to the tricuspid. Tricuspid is palpable and no noted murmur bruit. And then I'm going to check the apical pulse. Apical pulse is palpable and regular. So now I'm going to check for the lung sounds. Take a deep breath. Okay, if you can just turn a little bit on your side. Now check. Take a deep breath. Good. Patient's lung sounds are clear bilaterally and no noted adventitious abnormal lung sounds. Okay. And then I'm going to go ahead and start with checking the abdomen. I'm going to ask the patient to lay down. You can lay down, sir, in the bed. I'm going to go ahead and inspect the abdomen. In abdomen, you're supposed to inspect first, auscultate, percuss, and palpitation. So I'm going to go ahead and check the abdomen, inspect the abdomen. Abdomen is soft, no noted open area, open sore, or any surgical, any sign of surgery with scars. I'm going to go ahead and check I'm going to auscultate I'm going to go ahead and auscultate the abdomen. The abdomen has no hernia, no side scar, no open sores, so it's good. We're going to start in the right lower quadrant. Bowel sounds are active in all 4 quadrants. In the normal thing, I assess the bowel sound in each quadrant 5 minutes in a total of 20 minutes. After that, I'm going to go ahead and check the lower extremities. Let me put the camera there. Lower extremities is intact, no noted open sore or anything. I'm gonna go ahead and check for pedal pulses. I'm gonna check for posterior tibialis. This is where I'm going to check for posterior tibialis. And this is for dorsal pedalis. I'm going to go ahead and check for capillary refills is intact. I'm going to go ahead and check for the capillary refills. Capillaries are intact and normal. Dorsal pedalis is palpable, regular, and also the tibialis pulse is intact. I'm gonna go ahead and lastly, I'm gonna check the strength of the lower extremities. I'm gonna go ahead and can you just go ahead and do heel to shin again? Good. Do you mind? I'm gonna go this way. Do you mind pushing me? So I just want to check your strength in your lower extremities. Can you push it? Good. So bilateral lower extremity strength is intact and normal. So that's the end of my assessment. I'm gonna go ahead and wash my hands again after, and then I'm gonna lastly ask my patient, is there anything else do you want me to do, sir?
No, that's okay.
Are you feeling okay?
Feeling good.
Good. So that's the end of my assessment. Thank you.